Hello, and thank you for viewing my project. My name is Rachel Kludy, and the project I completed for the 2020 Science Fair was a literary review entitled Gene Therapy in Regard to the Ataxia-Telangiectasia Mutation, also known as ATM, a review. Here's a brief explanation of what my project encompassed overall. I researched the ATM gene, its history, its effects on the health of the affected person, including a predisposition to cancer, along with increased immunodeficiency and radiosensitivity, among other symptoms. I also looked at previous clinical and preclinical studies conducted by other scientists that had to do with this mutation and trying to rectify it. Speaking of rectifying it, I explored different modern methods of gene therapy that utilize different approaches to trying to fix this abnormality in the genetic makeup. This included the use of viruses to insert DNA or viral vectors, using non-viral vectors like polymers to insert DNA, and clustered regularly interspersed short palindromic repeats, or CRISPR, and CRISPR-associated protein 9 or Cas9 technologies. I evaluated and determined which of these types of gene therapies would be most promising for me or other researchers to study in the future in experiments involving Ataxia-Telangiectasia or its mutation. Starting with ATM, this genetic abnormality is fairly less common in the world of genetic mutations. It was predicted to have a link to a higher cancer rate when families of Ataxia-Telangiectasia patients were surveyed. For more context, Ataxia-Telangiectasia occurs when the patient has two copies of the mutated gene inherited from their parents, while ATM occurs when only one copy is present and the symptoms of the disease do not show up. However, the higher genetic disposition to cancer remains. This gene was isolated in 1995 and determined to have this link to cancer risk. Having this one copy of a gene increases a person's lifetime risk of developing cancer from around 13% in an unaffected person to up to 40%, and it also has other troubling side effects for many, such as the previously mentioned increased radiosensitivity. Few studies have been performed regarding ATM due to its lesser-known status among breast cancer and other cancer patients and doctors. It is less common than well-known genetic mutations like BRCA1 and BRCA2, which stand for breast cancer 1 and 2. For more background on gene therapy, it is a very recent advancement in medicine, and techniques of gene therapy are still being widely explored to this day. It is defined as a treatment for genetically caused diseases, as opposed to diseases that are caused by viruses or bacteria, and this is done by transferring recombinant DNA into a cell, tissue, organ, or organism, and with the limited criteria being that it must not harm the organism or cause any negative side effects. Implanting this genetic information allows for a chance of rectifying the abnormal genetic makeup of the patient. Only one major problem inhibits this type of therapy: the lack of a known perfect delivery method. This leads to a search for effective delivery systems. There's a few different types of gene therapy being explored under this large umbrella of treatments. First is viral vectors, which utilize AAVs and rAAVs, which stand for adeno-associated viruses and recombinant adeno-associated viruses. Overall, this method has a very high success rate, and it shows more long-term results when successful. However, multiple complications arise. It has a high risk element due to it being associated with viruses, and a large chance that something in the procedure could go wrong because of the dangerous nature of viruses. They also have a very limited carrying capacity, even though they can be quite specialized when they are almost always specifically engineered. Because they are specially made, they can be incredibly expensive, having one of the highest price tags on any type of treatment overall. This makes them very inaccessible to the average person. There's also non-viral vectors, which use cationic liposomes or polymers. This is a very wide range of treatments because it encompasses everything but viruses, and they are relatively safe compared to viral methods because viruses pose a higher risk of danger. Some of non-viral vectors' problems, however, can include that they are not as efficient or successful because the body and immune system can often reject them and have defenses against non-viral foreign objects to prevent them from completing their job. They also wield less permanent results in most cases, and this method is less researched than viral vectors, simply because of the time they have been researched. Last, there's CRISPR and Cas9 technology, which is very new and up and coming. The earliest trials of this type of therapy were around 2013, so less than 10 years ago. It shows great promise and potential, but it has a very large lack of research backing itself up to its very, very recent discovery. It has seen great successes and great losses, with multiple tragic deaths and also multiple groundbreaking accomplishments. It also has concerns similar to the viral and non-viral methods, being that it can often trigger cell suicide, also known as apoptosis, and this leads to it failing in many instances. It is also commonly suppressed by immune systems similar to non-viral methods, and due to its lack of research again, many variables about it are not yet understood. In conclusion, because of viral vectors' characteristics, they would probably be very helpful in non-human trials, where risk is not as much of a concern because they yield more effective and long-term results, and have an extensive history of trials and more background information at this time. However, if human trials are being considered, non-viral vectors should be explored to minimize risks to the patient and emphasize their safety. They also hold a greater capacity, and this is great in the specific case of ATM, which is a very large-scale mutation in the genome. CRISPR and Cas9 tech has promise for the future, but it is undeniable that it requires further research before it can be considered for the average experiment. Thank you for watching, and thank you for your time.